Good morning, team. Tracy Singson speaking. Let's get into our digestive system. So remember, I want you to go back over this PowerPoint where it's just the words. Click on the link where it just says digestive system presentation. And then you can access all these amazing short video YouTube clips, which are way more informative. But yay, let's get into it. I'll try and go nice and quickly so I don't bore you to death. What is your digestive system? Let me go back through here. It's basically a pathway from your mouth. It's a tube, basically a pathway from your mouth down your esophagus into your stomach, mashes up and breaks down in your stomach, down to your duodenum, through all your small intestines where all the magic happens, and then up through the large intestines and out to your rectum. You know, without being too disgusting, if you eat corn on the cob, it will come out the same because your body cannot break down the outside of the corn. That's telling you that this is a one-way system, and unless it's broken down chemically, it cannot leave this system. It's a one long tube. All right, I want you to label this into your books, and you can do that afterwards. Let's just get on to areas and the important stuff. Okay, so here's the terminology that you'll need to be learning. It may be asked. Some of this terminology only happens in areas of the digestive system. So we'll go through it nice and quickly. Remember, you can replay this at any time. Now, ingestion basically means taking it in. You can only ingest in one area of your body, and that is called your mouth. So when you take something into your mouth, you are ingesting it. Now, when you've taken a bite of that apple and you've ingested it, then you need to chew it to break it down. So mastication is another word for chewing. You'll hear this word if you're dealing with dementia, severe dementia clients, stroke patients, or anyone that struggles for eating and has a high risk of choking. You'll hear the terminology from the doctors of mastication. You can buy mastication utensils as well. All right, so that actually only happens in the mouth, doesn't it? So the next word, deglutition, swallowing. Deglutition only happens in your pharynx because you don't swallow anywhere else. So deglutition happens in your pharynx. Now, when you've chewed up that apple, masticated that apple, and then your pharynx has deglutition, it needs to go past your epiglottis to get to your start of your main digestive system. Remember, the start of that is called your esophagus, or if you're in America, esophagus. So once it starts making its way down the esophagus, there are certain wave-like muscular contractions. Those muscular contractions is almost like when you want to get the rest of the toothpaste out of the end of the toothpaste tube. You need to get your fingers at the end and you squeeze as hard as you can to get all the toothpaste out into the mouth so you can put it onto the toothbrush. Now, that action of you squeezing the toothpaste all the way through to the end is called peristalsis. So wave-like muscle contractions that can only push things one way. It's like a Mexican wave, can only go one way. And that happens in various areas all around your digestive tract, peristalsis. Cool. Okay, segmentation is what it is. It's when the muscles do go backwards and forwards to break down the food, to break it down so it's ready and can spread so all the villi, which you're going to learn about, can absorb all of the chemicals into the body. We'll learn about that. Relaxation of sphincters. You should know what sphincters are now after doing the urinary system. Sphincters is a band of muscle that contract to not allow to stop substances from flowing through, and then they relax and open up so substances can flow through. You're going to learn where these sphincters are in the digestive system as well. Absorption is what it is. It allows the body to absorb chemicals into the bloodstream, nutrients into the bloodstream. Now, churning of chyme only happens in one area. That only happens in the stomach and nowhere else. So your stomach is layers. There's about 3 or 4 layers of smooth muscle. Also with lots of layers of mucus, submucosa, and rugae, because your stomach produces a real high potent acid to break down the foods. Now, as it produces that high potent acid, it has to like mix and get all around that food so it can break every little part of that food down. And for that to happen, the stomach has to what we call churn And the food, once it hits the stomach, is not food anymore. It's called chyme. Some people call it chyme. Some people call it chyme. So in the stomach, that food is now called chyme, and the stomach is churning it to break it down even more. Cool. Okay, these ones happen in certain areas. It's coming next. Mechanical digestion and chemical digestion. Now, mechanical digestion is basically when the digestive system is actually physically moving. So peristalsis is mechanical because it's the muscles is actually making the esophagus move. The stomach that is moving to churn that chyme down is called mechanical digestion. Deglutition, which is basically your pharynx having to swallow, is called mechanical digestion. Same as mastication, same as ingestion. So it happens in many areas, not every area, but many areas. Now, chemical digestion is when substances enter the digestive stream to chemically break down the food so it can allow the chemicals to be absorbed into the body. For example, to be absorbed into the cells for energy, okay, and which we'll learn about that. Elimination is elimination. Get rid of. You can eliminate through vomit. You can eliminate through going to the toilet. All right, let's find out where all these things happen. Again, let's move nice and close. So we have the mouth, the oral cavity. So in the mouth, you are ingesting food. Then the mouth is breaking it down with its teeth and its tongue, and saliva is being produced. And that is called, correct, mastication. After you've masticated it, you need to swallow it in the pharynx, and that's called deglutition. So right now, it's now what we call like a bolus or a pulp, a bolus. Now, as it passes past the epiglottis, so it doesn't go into your lung area, it comes down your long food pipe. This long food pipe is called your esophagus, or if you're in America, esophagus. Now, to get that bolus from there to there, it will happen if you're standing upright or sitting upright because gravity will assist, but also there are wave-like contractions called peristalsis that forces that food all the way down here. So yes, it's uncomfortable, but you can eat upside down. Now, when it gets to this area here, just before it hits the stomach, there is a sphincter which you're going to learn about. Don't worry about the name. Just listen to my voice at the moment. This is called your cardioesophageal sphincter. Now, that sphincter has to open up to allow this bolus to go into the stomach. Now, if there's something wrong with that sphincter and it doesn't close and open correctly, you can get what you call reflux, okay? Reflux, which is an acid burn. And for some reason, this acid of the stomach is wanting to come up and the sphincter is not closing properly. Not sure what the reason. Many are reasons for that. Okay, so your stomach is quite high up. It's basically just under your rib cage, at the bottom of your rib cage. It can expand up to 4 liters, and it can also shrink because it's a muscle. In here, this is where that pulp, that bolus, gets churned and broken down by all the stomach's acids. By the time the stomach has finished with it, it looks like a smoothie substances, hopefully. In here as well, with all the acids that are breaking down, a lot of the protein is broken down and is absorbed into the body for build and repair, which you can learn on afterwards. Once it's broken down effectively, there's another sphincter here called your pyloric sphincter. This will open up to allow what we call chyme. It's not food, it's not bolus, it's broken down to a smoothie and it's now called chyme. This sphincter will open up so this chyme can go into the first part, and it's going under this part here, the first part of your small intestines. Now, this is your duodenum, or some people say duodenum. It's up to you. Duodenum, I believe, is the correct terminology. This is your first 2 inches of this long 7-meter small intestines. Now, why this has got a different name is because a lot of magic happens here. Here is where your pancreas inserts its pancreatic juices and also the endocrine function of the insulin. Also here, the gallbladder is going to insert bile, which breaks down fats, which we'll learn a little bit more. Okay, so there is something being added into the duodenum of the small intestines. But everything is still in here. Now, what happens now is that chyme that's being broke down from these bile and pancreatic juices and insulin, and also that mucus and the acids and the enzymes, which are being produced from the small intestines, are all being released as it goes down this journey. Your small intestines actually does most of the magic of absorbing all the nutrients that your body needs, which we'll go on to afterwards. So this journey here can take up to 7 hours and 12 hours. The longer it's in there, sometimes the better, because your body absorbs more, but also you don't want it in there too long so your body gets a little bit constipated or pain. If you've got diarrhea or vomiting, obviously the chyme is going through this really, really, really fast. So if it's going through extremely fast and coming out as diarrhea, your intestines is not being allowed enough time to absorb the nutrients. Therefore, the body will suffer. So when you do have vomiting and diarrhea, you feel pretty crappy for quite some time and lethargic because your body has no energy because it hasn't been able to absorb it. The intestines are so big and so long that this is where you feel a lot of the uncomfort. So if you do have a gastro bug, really it's the stomach. It's normally 90% always in the small or large intestines. This is what causes you the most grief. It also has a huge, huge nervous supply. So you may have heard of your intestines or your digestive system as being your second brain. There's so many nerve endings here that so-called saying of I have a gut instinct or my stomach's telling me something's not right. It's true. It's actually true. Okay, once it's all been broken down, there's a lot of waste left over. So all the goodness should have been taken out by now. And all the waste then gets passed into what we start to call the large intestines, this big area here. Now, this is also known as the colon. So if you've heard of colonoscopies, you've heard of colon cancers and colon bypasses, this is where it's all happening. So what comes out of here, there's an ileocecal valve of everything that's been cannot be absorbed from the small intestine goes into the large colon. And from here, basically the only thing that's being absorbed back into your body is water. So this part of the large colon is called your cecum. You can see your little appendix there as well. Your appendix has a bacteria to break down any more bacteria, has a good bacteria to break down bad bacteria. But we don't need this as much anymore because our food is washed, it's prepared for us. Even when we take it from the land, we know to clean it, we peel it, and everything's in packets. So we don't really actually need too much of this bacteria anymore, you'll notice. All right, so the food passes into the cecum, and there's lots of segmentation happening here and peristalsis action. It's making its way all the way through the transverse of the large colon, and then it gets to the descending colon, and then it will get to the zygomoid colon area here. By the time it reaches the rectum, which is here, this is what we call the garage, a storage here. All of the water should have been absorbed back into the body, and all that should be left is waste. Yes, waste. Now here you've got two sphincters in your anal canal. One of them's going to hold on until you go to the toilet, and then the internal one obviously is involuntary, so that will just relax. But this external one, which is voluntary, you're going to clench it tight until you get to an appropriate place where you can go to the toilet. But of course, if you've got dementia and your brain is starting to shrink, those sensible signals to go down here to say, hey, we need to hold on till we go to the toilet, those neurons that have given that information are dying. So that's when we see some not so nice things that happen to our poor dementia clients, and they might have to wear an adult nappy. All right, so that's real fast. And we haven't talked about the liver, the gallbladder, the pancreas. There's a lot to go through. So let me flick through here. There you go. So this is where the sphincters are: cardioesophageal sphincter, pyloric sphincter, and here's the two sphincters in your anus called your internal involuntary sphincter, external. This is also where all your hemorrhoids happen. So you can get external hemorrhoids and internal hemorrhoids. External hemorrhoids are the ones you visually see. Internal you can't see, but they're extremely painful. And most of the time, the elderly get hemorrhoids from having constipation, and they strain so hard that they burst blood vessels and a little bit of muscular lining. So it's not good to have constipation. This is basically what I've said. In the mouth, what happens? All these certain things happen. You are chewing, you're taking in. Right, what you haven't told you straight away, in the salivary glands, we have enzymes. Now, enzymes are a small chemical that breaks down other chemicals so it can be absorbed into the body. A really good a methodology of this is, if everyone's heard of Raro powder. So you have a beautiful cold glass of water. You put the Raro powder to make a beautiful drink into the water, but that drink is going to be disgusting until you stir it up, and you need to stir it up to get that Raro powder diffused into the water. So what the enzyme is there with that situation, the enzyme is the spoon. You have to have the spoon or a substance to stir up the water and the Raro to diffuse it to make that drink effective and nice. So in these glands here, we have lots of different enzymes. Now, all the different enzymes have different names, amylase and so forth, and all different enzymes focus on different jobs. The enzymes in the mouth actually focus mainly on breaking down carbohydrates. When carbohydrates, which is your breads, oh, that fresh bread, it smells so good in your mouth, salivas. When carbohydrates are broken down, they're broken down into sugars. Good sugars efficiently, but then, of course, if those good sugars, glucose, is not used up, it turns into fat. But when you smell bread or you smell biscuits being baked, your mouth will water. And it is water because these enzymes are starting to be produced to cause your mouth to produce saliva. And in that saliva is those enzymes to start breaking it down. Yay! Now, as you can imagine, as you get older, these salivary glands reduce. Therefore, they don't have that beautiful fluid to help break down that food. Hence, you're always encouraged to give them some sort of fluid, no matter what it is, while they are chewing their food. Also, anyone with any throat cancers or radiation, these salivary glands will have been blitzed. So therefore, fluid is a big part of their diet. All right, thanks. If you can go back and watch this video without my voiceover, you will see the peristalsis action. It's hilarious. Nice little YouTube clip here of what happens when your body swallows, how peristalsis and the bolus goes down. Please go back and have a look in the esophagus. Here you go. Here's your stomach. So a great little video YouTube clip here. It's a bit old now. I need to update it. But in here is your stomach and the stomach areas. All here is all the smooth muscle. So these smooth muscles are all lined in different, they're lined differently. So they can only contract one way. They don't want the stomach just going backwards and forwards. It has to make like a big gurgling noise, which is a good gurgling sound. So it's always contracting. 3 different layers of muscle, smooth muscle, constantly contracting and stretching. Okay, and in here is what we call rugae. This is a thick layer of mucosa and submucosa. And within these folds, we're going to learn this is where all the acids are produced of a high acid content that starts breaking down all of that, what we call now chyme, not food, breaking it down to a chemical level and breaking it down into a slush. Now, a high amount of proteins are broken down into the stomach. They're broken down all the way through the small intestines, but it is here where they're broken down predominantly. And what are proteins broken down to? They're broken down into what we call amino acids. Amino acids go all around the body to help build and repair cells. So protein in the diet is really healthy, especially when you're exercising or you're studying and you need your brain to work. Okay, so lots of protein is good. Now, those that have had a Stan Walker, a stomach sleeve, they've basically had this whole area cut off and re-stitched up. So this whole area is cut off and re-stitched up. So they don't really have a stomach. Okay, they don't have a stomach. Now, bless poor Stan Walker, he had it done because he had stomach cancer. But people go in and opt for this, and it's called a stomach sleeve for them to lose weight as well. There is also a elastic band, and that's when they cut this area, not cut area, they tie this top area of the stomach here. And when they tie this big fundus area off, the stomach is naturally shrunk as well. Okay, so there's a sphincter there, and there's a sphincter here. This pyloric sphincter, this will not open until the food is all broken down into like a smoothie paste, but we call it chyme. Right, let's carry on, because I know you haven't got much time. Right, small intestines. This is where the magic happens. So your small intestines are broken down into different areas so they can be located. Your small intestines has layers and layers. The small intestines is where most of your vitamins, your minerals, your nutrients all get broken down and absorbed into the body. How does this happen, I hear you say? Right. Your small intestines have something called a layer of villi, microvilli, submucosa, mucosa, and then a thick, thick layer around it called serosa. Okay, serosa is just a big connective tissue. In this little image here, you can already see, what do you think the yellow is? So yellow is all your nerve ending. It's picking up and detecting all of the nutrients and vitamins and minerals your body need. Whether you're hydrated, pain, bacteria, acids, whatever it might be, there is always signals going into this small intestines. Huge amount of blood vessels. And you need this huge amount of blood vessels because as the substances in here are getting broken down, your body needs to absorb them into the blood to be transported around the body. Okay, how does this do this? I've got some great images here. Let's click onto this one. Hey, all right. So if you were to open up your small intestine, you would see it's very wrinkly, extremely wrinkly. This wrinkly substance is called villi. Now, the reason it's wrinkly, can you remember when we talked about the brain? The more wrinkly the brain, the more surface area for neurons. So a human brain is nice and wrinkly, therefore more neurons can cram into the area. Where you got a chicken brain or a mouse brain, it's smooth, so less neurons can get into the area. Hope that makes sense. Now, on every villi area, there's another wrinkly area called microvilli. So not only has it got these big ones and then these little ones, then there's microvilli. So if you think of that smoothie paste liquid coming through your intestines, that smoothie paste can actually fall into every little nook and cranny, can't it? Every little nook and cranny. So all of those vitamins and chemicals that are in that food can now be spread along the small intestines, allowing for all of the allowing for it to be broken down and absorbed into the bloodstream, which then gets taken into the body to feed all the areas that it needs. I hope that makes a bit of sense. Here is a good live image of all your villi. It looks like velvet. Hey, lots and lots of velvet. Now, this is a good image, but you can imagine there's a lot of mucus in here, a lot of slime, a lot of saliva, and there are more little nooks and crannies where polypses may happen. Now, we talk about some diseases, celiac disease. Now, if for some reason someone has celiac disease and they eat something that their intestines don't like, the natural response of the intestines of the villi is to swell. Now, as you can imagine, if these villi swell, not only does it cause horrific pain, because the nervous system picks this up, horrific pain, the substance that you eat, there is no gaps or creases for the food and nutrients to go into, to be broken down, to be absorbed into the body. So if your villi has swollen and it becomes like a smooth surface, the food is just going to shoot through and come out like diarrhea, isn't it? So there's no nutrients that can be absorbed. Therefore, for someone with celiac disease, they will become weak and frail until they know exactly what's affecting them and what's causing the intestines to swell up. So it can be it can also be mistaken for irritable bowel. Irritable bowel is not celiac disease. Celiac disease is a definite disease, but it has the similar symptoms. Irritable bowel is a generic name for this area swelling due to an unknown cause, probably been allergic to eggs or whatever it might be. The body doesn't like it. So when the body doesn't like something, it will slightly swell, and then it will cause no absorption of nutrients. So all of those nutrients and vitamins and minerals will just slide through the body, come out, and your body cannot effectively absorb it. All right, where are we up to? Hey, large intestine. So everything's been broken down on this journey in your small intestines. And then once everything's been absorbed efficiently in homeostasis, there's literally shouldn't be not a lot left to be absorbed. So what happens here is there is another little valve here, and whatever's left over, all the waste, will then make its way into the large intestines. Your large intestines are broken down into areas. Your large intestines are also called your large colon. This is where, we'll talk about it. We'll tell you the area first. So some waste will come in here into the cecum area, or as much waste as it can. As it's in the cecum area, this large colon will give a peristalsis action to move the waste up through the ascending colon. The waste then will get slowly moved along the transverse colon, and then that waste will go to the descending colon, here to the sigmoid, and then it will sit here in the rectum waiting for you to feel the need, the pressure for you to go to the toilet. The only thing that's really absorbed back into the body is water. Okay, it's mainly water. What's left over here your body doesn't need, or can't absorb, or don't want to absorb, or you have too much of it. So that's just where it stores it here, waits for you to go to the toilet. Neat. So there's a Bristol stool chart I want you probably all familiar with. If you've constantly got diarrhea, you are going to be dehydrated, and your body is not going to be absorbing all the nutrients it needs. So you need to want to know and learn why. Why is that happening? Cool. Neat. Moving on. All right. So there are digestive organs. We have the liver. Now, the liver is a huge organ, and you cannot live without your liver, but there is certain research now that it can be reproduced. Now, your liver is a massive organ. Anything you consume into your mouth, absolutely anything, whether it's medication, food, drugs, alcohol, everything gets passed through your kidneys, as you know, but also your liver. Your liver is a massive organ that will detoxify anything bad into something less harmless. Okay, it detoxifies everything. So your liver is working 24/7. If you overwhelm, you've probably heard of alcoholics have something called cirrhosis, and that is when the liver cannot cope with detoxifying all that alcohol day in, day out. So the cells of the liver basically swell and give up. Now, the cells of the liver, or the cells that make up the liver, are called hepatic cells. Hepatic cells are what basically breaks down harmful substances. Now, you may be familiar now with hepatitis. Hepatitis A, B, C, D, and E. So hepatitis is cells of the liver that are infected, so to speak. The different cells of the liver, they have different A, B, C, D, E hepatitis because they are contagious in different ways, and they have been caught, as in like you've caught the disease from different ways as well. So it's a whole nother conversation there. But what does your liver do? It absorbs any harmful substances, breaks it down, and the ones that are healthy go back into your body. The ones that are not will go into what we call our gallbladder. Oh, let's go to the gallbladder. Your gallbladder here stores all the crap and the waste that your liver has broken down, the metabolic waste, so to speak. So what is sitting here in the gallbladder is what we call bile. Now, bile is a high acid base, and bile will break down fats. So as it stores what the liver is breaking down, the bile from this gallbladder will squeeze out and slowly enter into what we call the small intestines, the first part of the duodenum. Bile breaks down, emulsifies fat. Bile is basically like you putting washing up liquid in a greasy frying pan. If you just wash a frying pan with cold water, you're not going to break down those fats. You need to have washing up liquid, essential, and warm water. That's what bile does. It will break down those fats. Some of those fats are healthy fats and they will go to your myelin sheath and to your connective tissue. Some of those fats are not so healthy, are they? If you don't have a gallbladder, it doesn't matter. Your liver will still produce it. And on demand, it will still, as you can see, come down these ducts and go into the small intestines. It just means you won't have a storage of it. So if you do not have a gallbladder and you have a high amount of fat in your diet, your body will suffer. You need to monitor your diet. Now you will need to do a lot of research, your research on the pancreas. When you watch this YouTube video, it's really, really important. Your pancreas has two functions: endocrine function, exocrine function. Now, an endocrine function means that your pancreas produces a hormone called insulin. Insulin is then squirted into your small intestine of your duodenum. Insulin is a hormone that will which will go along with the sugars or go along with the glucose, and insulin will open the doors for glucose to get into your bodily cells to produce energy. If you don't produce insulin, that glucose, that sugar is just going to travel around your body, travel around your bloodstream, and not do its job properly. So this pancreas that produces insulin into the digestive system that goes into the bloodstream, the insulin is the key to open the cells to allow the sugars and the glucose to go into the cells to produce energy so those cells can work. You can be insulin resistant with diabetes, where your pancreas still produces insulin, but it won't open the cells. It's like the keys don't work, keys don't match. Or you can have diabetes where your pancreas does not produce insulin. Therefore, then those people have to inject insulin manually into their body. Have a read of this. Do a lot of research on diabetes. Your pancreas also produces pancreatic juices from your exocrine cells. Pancreatic juices is what gets squirted into this area again here and helps break down in all your proteins into a chemical format again. So it's always breaking down your lipases. So have a look at this video on the next one. Very important, pancreas. It's your pancreas that is affected when someone has diabetes, whether it's type 1 or type 2. You need to learn about this for your next project. All right, you can go through the rest of this. It just tells you here what proteins are broken down for and where you get them from. Carbohydrates and lipid fats. Please look at this again. I'm just going to go through where it's just the words without my voiceover. Please have a good look. And there's some fascinating clips I want you to look at of people changing their colostomy bag, okay, and how independent they can be and what to look out for. So please have a look at that. Most people that have a colostomy bag are instructed and taught how to change it themselves. It depends if they have a colostomy or an ileostomy. And the only time you'll be changing a bag is if you're assisting them because they can't do it themselves. And you do not, you only change the bag. You only actually take the pad off, which you'll look at maybe once or twice a week. When you are changing the actual sticky pad, this is where you have to really look at skin integrity, especially on the elderly for infection. Okay, so enjoy the next couple of clips. I've talked enough. I hope you haven't got a headache. Please go over it again if you're stuck. And I'm trying to get out of here and have fun. And please do the quiz. The quiz will help you with your learning, and definitely start researching the pancreas and diabetes. Good to know, need to know for your next assessment. Stop.